welcome. Welcome to the MBLEx review course. My name is Jody Scholes. I'm your instructor. Today we are talking about medical terminology, sometimes called healthcare terminology. Yeah, yeah, medical terminology. For the MBLEx, we are going to need to understand some some medical terminology and how to break apart what's called word elements. We're going to be talking about that today. So class today goes down in 3 rounds. First, we're going to talk about a test taking strategy. Next, we're going to do our learning. And then at the end of our learning, we really continue our learning, but we dissect questions. And I have 12 to 14 questions for you today on medical terminology. We're doing this a little bit differently. So today, test taking strategy. You can incorporate what I'm about to show you right into the moment you're sitting down at the Pearson VUE Testing Center. Many of you have been there before. Many of you have already tested once, twice, 3 times. We call that failing forward. No big deal. You're here now. Divine order. All is well. But I want to take about 3 minutes with you before we jump into our learning to clear off your desk. I don't mean that literally. I mean that figuratively. If our mind is our dining room table, our desk, our learning surface where we learn, there's a lot of things that get thrown on top of the desk all day. Oh, I gotta remember to make that phone call. Oh, I need to follow up about that refund. I need to make that payment. There's all sorts of to-do lists that operate in our mind. And on the day of your MBLEx, you've been very good in the past at setting that aside and knowing that you have to completely focus on the task at hand. And so let's go through a moment, about maybe 2, 3 minutes of bringing our focus to studying. We're going to do that through the vehicle of gratitude. I know all of this mental stuff, Joe, 3 answers or 4 answers. Let's be concrete about this. Your MBLEx has both styles of questions, 3 answers and 4 answers. But until your mind is straight, until your mind is clear, until your mind is ready to learn, I'm just making noise. You might be hearing me, but your brain is not able to listen. So, with that in mind, let's do a little exercise. Feel your feet on the floor. This is going to be 2 minutes. 2 minutes. So if you're driving, don't do this exercise. You can do it with your eyes open. Feet on the floor, wiggle your toes. Feet in the car, wiggle your toes in your shoes. I'd like you to bring your awareness to your feet. Bring that awareness to your feet. Yes. You can close your eyes if you want, or you can have a soft gaze, or you can focus on driving, whatever's happening for you right now. But I want you to send some gratitude to your feet. Just say thank you, feet. Thank you, feet, for all you do, all the places you bring me, all the places you've brought me. If your feet are working and they're working well, they walked you in to the testing center, or they will walk you in the future to the testing center. They have brought you to some amazing places, those feet. I'd like you to just tune in tune in to your feet and say thank you. Thank you, feet. Thank you. Thank you for all the amazing places that I've been. Thank you for all the amazing places that we are going. So grateful to be present in this body, in this lifetime, with feet that work, with the ability to move. If your feet don't work, if your legs don't work, that's okay. The ability to get from one place to another. Still thanking your feet, no matter how well they work. Thank you. Thank you for being my feet. Bringing your attention up the front of your legs and to your hips. I'd now like you to imagine light coming up from Mother Earth, light coming up from Mother Earth, through your feet, up to your hips. Whatever color light you want to make that. If you want to make it gold light, white light, green light, your favorite color light, surround your lower body, your hips, your legs, and your feet in that light. The energy of Mother Earth is flowing up through your feet, up your legs, and to your hips. I'd like you to become aware of your side body and your shoulders. As that light moves up your torso, it arrives in your heart center. I'd like you to imagine that light filling the space that is your heart center. It's starting to flow down your arms pretty naturally. And that light comes up into your throat. It's filling up your throat area. And we say, thank you. Thank you to our voice box. Thank you. Thank you that I have a voice. Thank you that I'm learning to use my voice. Thank you that I am able to speak. While we're here, you can say thank you for the thyroid. That helps to control your metabolism. We're so grateful for our voice box, our thyroid, as this light fills our throat. And eventually that light raises right up the back of our neck and surrounds our head. And I'd like you to imagine a little string on the top of your head. I'd like you to pull that string up, elongating your spine. Yeah. That string, that light, that connection to the sky. You are the connection between the earth and the sky. This light that fills your body. This light of gratitude for this body, for this life experience, for being able to feel this light. We are so grateful. We're so grateful to be present here and now. So grateful for the magic that is the internet, the magic that puts us all in the same room. So grateful for that. So grateful we can study, we can learn, so grateful that we are evolving our human spirit, evolving our mind, evolving our knowledge. We are progressing. We are sharpening the sword. We are becoming even better human beings. by being present here right now. And for that, we are very grateful. We're so grateful that by showing up in this space, we have set the intention of self-improvement. We have set the intention of continual improvement. Thank you for just showing up. In doing so, you send that message to the sky, to the universe, that you are ready to learn. You are ready to become an even better version of the best self you are right now. I believe you are a fantastic version of yourself right now. And by showing up here, by pausing, by setting the intention on this day and this time to study, to learn, to lend your energy to this community, you are becoming an even better version of you. And as you proceed, I'd like you to bring your awareness back into your body, maybe wiggle your fingers a little. And know that as you progress through this class session, as you progress with your day, this light is in your body. You are full of knowledge. You are full of gratitude. And it paves the way for a beautiful day. And so it is. And so we begin this. All right, and away we go. Medical and healthcare terminology. Yikes. Let's make it happen. So healthcare terminology, why is it important? Well, when we are communicating with our colleagues, when we are communicating with our clients, with our clinic colleagues, if you work at a massage spa or clinic or center, when we're communicating with other healthcare professionals, there's some medical terminology that comes up. And in real life, you're going to be able to look it up, to be honest. If you see something on a chart and you're like, ooh, I wonder what that is. And we have some words today that I literally looked up to learn how to pronounce. So this is an ongoing learning. This is ongoing. Like, again, we talked about continuous improvement. Enhanced communication with our clients and our colleagues is clear communication, enhanced communication, better understanding of conditions. Also, of course, there's professionalism, right? And according to ELAP, so ELAP, remember the entry level assessment project, there's a few things that licensed massage therapists will need to know how to do. So demonstrate knowledge. So this is for the MBLEx. Demonstrate knowledge of key terms related to healthcare terminology. And if you see here, this bold part of the statement, the ability to break down unknown words into word elements. So they assume you are going to, that you are going to have some unknown words. Yeah. So that's okay. We're going to learn how to break down those word elements today and become more familiar with them. So use a medical dictionary. I also put in bold the positional and directional terms. Guys, you're going to need to know the body planes. You're going to need to know these positional and directional terms to navigate the body. If those are challenging for you, we have several classes on navigating the body. It'd be great on a day to go back and review that navigating the body. All right, but this is what ELAP says is that we need to know as far as medical and healthcare terminology. So today we're going to have a little fun. We're going to do a pre-quiz. A what? Yeah, a pre-quiz. So hopefully you have a piece of paper, grab a pen. Let's see how you do on the pre-quiz. You don't have to put this in the chat. We're going to wait till later to use the chat, but just between you and me, let's go through these, okay? Little precursor. What happens if you would get these questions on the MBLEx now? Ready? 1. Which word is associated with a part of the integumentary system? So which word in these 4 selections, and you don't have to put it in the chat, you can just put the letter down on your piece of paper. Which word is associated with a part of the integumentary system? A, sclero, B, phleb, C, dermis, D, neuro. Okay, got your answer? Got your answer? We're only doing 2 slides here. Ready for an answer? Pretty sure you got it? Boom. Dermis. This is an example of a prefix or a suffix. The word dermis always is talking about skin. Skin is a part of the integumentary system. So we're going to look for the breadcrumbs with these words and figure out, okay, what system are we in? What part of the body are we in? Ready? So keep your score. I'm going to ask you to put it in the chat when we're done. Like, did you get 3 out of 5? Did you get 1 out of 5? See how you do. All right. Next question. What hormone is responsible for helping the body deal with long-term stress? What hormone is responsible for helping the body deal with long-term stress? A, cortisol, B, epinephrine, C, insulin, D, melatonin. One of these words has to do with long-term stress. Got your answer down? Okay, here we go. What hormone is responsible for helping the body deal with long-term stress? Boom. A, cortisol. Cortisol gets a bad rap because when it's present in the body, we're all like, oh my gosh, you've got cortisol. I've got so much cortisol. Well, that's because it's evidence of long-term stress. In fact, research has shown that men who have a pot belly, is that rounded belly, kind of like a Santa Claus belly, that pot belly, that there's strong evidence that cortisol has been involved in that physical formation of a pot belly for men. But cortisol is there because it's helping to deal with this long-term stress. It's the antidote to epinephrine and norepinephrine. All right, we're not here to talk about the hormone system today, but best answer was cortisol. Ready? Let's go. Lymph nodes are important because they, what? A, produce insulin. B, filter lymph and fight infection. C, create melanin. D, regulate body temperature. Why are lymph nodes important? Got your answer? All right. Best answer. Boom. Because they filter lymph and help fight infection. Talking about the lymphatic system, right? Yeah, I know we're talking about medical terminology today, and we're creating a bridge between terms and what they mean. Next question. Number 4. The adrenal glands are located blank. The adrenal glands are located blank. A, on top of the kidneys. B, inside the brain. C, beneath the liver. D, along the spinal cord. Where are the adrenal glands located? You could get this question on the MBLEx. Think about what system of the body are we talking about? Where are we in the body? All right. Got your answer? I know you're second guessing yourself, but that's okay. Go with your first answer. Go with your first answer. Okay. Best answer? Boom. On top of the kidneys. That's where they're located. Just warming up your brain. Yep, there they are. Oop. Thought I had a picture there, but I don't. Okay. Last question. Ready? The prefix hypo in hypothyroidism, the prefix hypo in hypothyroidism means what? A, over or above. B, fast. C, under or below. D, beside. What does the prefix hypo mean? Yeah. Got your answer? Good. Boom. Under or below. So hypo, right? Down. Hypo. Hyper is the up. Okay. The prefix. Prefix hypo. Okay. How'd you do? Stick it in the chat. How'd you do? Yeah. Let me know. Let's see. All right. Teresa's got him all right. Whoop, whoop. Good. Rob, 5 out of 5. Nice. Anybody else chiming in? John Robert got all of them. Nice. Good work. Good work. Weren't thrown off by it. Woo! Good. Chanique said 4 almost got me. Yep. Yep. Good. Glad. Oh, good. Camelta. 4 out of 5. That's nice. Excellent. Man, if you're in that 3 or 4 or 5 out of 5, boom. Yeah. It was a little easy. It was a warm-up quiz. Yep, a little easy. Let's get into it. I wanted to ease you into this today because medical terminology can be a lot. So here's our medical cheat sheet where I'll have a few handouts. We'll have a few worksheets for you when this lesson is posted that you can print out. They're called our little medical cheat sheets. Before we get into our cheat sheets, I want to walk you through the words prefix, root word, and suffix. Because depending on where you went to school, and if you had a real interest in English or in grammar, you may, or if you have English as a second language, you may or may not recognize these words. So pre, right, comes before. Prefix. Root is the root word, the stem. So you might see root word, the stem of the word. And then the suffix is at the end of the word. So let's take a peek at this. Here's the prefix, right? These first 3 letters, they're giving us an example, or it's directing the stem of the word. A prefix can sometimes change the stem of the word. So lucky, look down here in the last row, lucky. When we put the prefix un in front of it, changes the nature of the word. Unlucky. Lock, unlock. So a prefix is important because it directly affects the stem of the word. The root word, yep, so the main part of the word. So we've got that prefix underlined, but the root word is circled. And so trust, when you put distrust in front of that, we change the name of it. So untrue, unhook. So locate or relocate, write or rewrite. Very good. That's the root of the word, also sometimes called the stem. And then finally, the suffixes that come at the end of the word. So able, being able to, ed, past tense, bump to bumped. And if you learned English as a second language, uh, these these suffixes impact the word. Here's some ideas, suffixes in English. So directions, and we can pull these apart. They often stand on their own, but sometimes they're just giving us a time frame as far as or making a verb a noun. You don't have to worry about the grammar. Just being able to break apart or recognize that the suffix comes at the end. So let's take a look at these suffixes. So we're going to pull apart some words today. And unfortunately, there is some memorization here. And normally I don't like to ask you to memorize. There's only certain times, but some of these things we are going to have to memorize. So so we'll look at a bigger word, but I want to start with ology, and that's the study of, because you've heard of biology, you've heard of astrology, you've heard of these ology words, right? So biology, ology is the study of. So bio, the study of life. Astrology, the study of astro, the study of stars. So we're pulling apart a compound word, just two parts of this word. Some medical terminology is going to have three parts, prefix, root, and suffix. This is a root with a suffix. An example. Here are some word elements combined. Ones you may or may not have heard of. Several of these you have heard of. So let's take a look at the term antiseptic. Heard of this word, right? So let's look at the word elements of antiseptic. Anti, against. If we're anti-war, if we're anti whatever, it's against, right? So anti. And then septic. Septic usually means there's been germs. If someone is a problem with their belly and they're at danger of being septic, that means there's some germs that have invaded their space. So antiseptic, that would be effective against germs. Pretty straightforward, right? Two parts of that word, anti and septic. Now let's take a look at a body word. Contralateral. Ooh, we've seen this in some practice exam questions. The contralateral. All right, let's look at it. We usually see contra with like contraindicated, right? Contra. So it's opposing. No, it's contra indicated. So, and lateral on the side. So contralateral means the opposite side. This is usually we see this word when we talk about movement. All right, here's another body word, subaxilla. You got this one, right? Sub, under, just like a submarine goes under the water. Axilla, armpit. So under the armpit. Yes, now, I'll skip that, but just let's stick to the words today versus treatment. Neurogenic. Ooh, neurogenic. Okay, let's look. Neuro, nerves, brain, right? Neuro, nerves, neurosurgeon. Yeah, that's dealing with the brain and spinal cord, dealing with the nerves. Um, Genic is like Genesis. The first book of the Bible is Genesis. It has the same word origin as genic. It's the origin, in the beginning. It's the origin. So in this case, neurogenic, it's originating in the nerves. If someone has neurogenic pain, genic, it's originating in the nerves. Okay, terms you may not have heard before, but we're breaking apart these word elements and getting to understand more about each word. And then bradycardia. It's a little bit weird. Brady actually means slow. Hypo means slow. We could say hypocardia. Now and then you do see the word Brady. Sorry about that. But it means slow. So in this case, someone has been diagnosed with bradycardia. It's a slow heartbeat. Brady is slow. Here's a few more. Neuralgia, nerve, algia, pain, nerve pain. Well, here we go. Contra, indication. Contra, opposing. Indication, desired result. So if it's indicated, then it will be helpful. If massage is indicated for low back pain, it means that it will be helpful. If massage is contraindicated with someone with the flu, it's going to oppose that desired result. It's going to be opposing it. Periosteum. Ooh, bone word. Periosteum. Look at it. Peri, osteum. So peri just means around. Oste, osteo. Remember osteoarthritis? Osteo has to do with bone. So periosteum is a membrane that surrounds the bone. Periosteum. Yeah. Well, you knew it was something to do with bone, right? Yeah. All right. Intracephal. Uh-oh. What are those words? Encephalitis. Maybe you've heard that term before. Encephalitis. This we chose the word intracephal. So intra within. Cephal means head. So encephalitis, in cephal in the head, itis, brain swelling, encephalitis. And arthroplasty, ooh, arthroplasty. Artho, joint, not osteo, artho. Remember, arthritis, joint. Osteoarthritis, bone joint. Osteoarthritis is inflammation, itis, of the osteoarthritis, of the osteobone joint. So artho, joint, plasty, surgical repair. So a reconstruction of a joint. Artho, so surgical repair of that joint. Reconstruction of the joint or surgical repair of the joint. All right, so you get some ideas of these word elements, how we can pull them apart. Let's pull this one apart. It's a long one. It is a medical word. This is a medical word. We got an ology, right? Over here. So ology, remember biology, right? Biology was the study of biology. Okay, now we got otorhinolaryngology. Yeah, we don't have to know how to pronounce it. Let's split it apart though. There's our ology. So it's the study of something. Ooh, rhino. See that word in there? Ooh. So we find words that we can identify within this. So OTO, rhino, larynge. Okay. Let's take a peek. What looks familiar? Does rhino look familiar? Rhino? Have you ever seen a rhinoceros? Maybe not live and in person, hopefully not. But rhino. So a rhinoceros has the horn. Rhino deals with the nose. Yeah. So, okay, we got something to do with the study of rhinos. Let's take a peek. OTO is related to the ear. Now, please note the difference between OTO, auto, and audio. Audio is hearing. Auto is the ear, the actual anatomy of the ear, which often audiologists, AUDIO, audiologists deal with hearing. Auto can be the biology of the ear. Similar but different. Rhino, right here we see, related to the nose. Yep. Larynx, larynge, related to the larynx. Oh, damn. Okay. So we got an ear, we got a nose, and we got a larynx. What is this? Oh, you'll be surprised. You actually know. So auto, ear, rhino, nose, larynx, the study of the ear, nose, and throat. This is the fancy long word for an ENT doctor. An ENT. Yes, exactly. The study of the ear, nose, and throat. But you can see how you can pull those words apart. You may not know auto. Rhino? Have you heard of a rhinoplasty? A rhinoplasty? Yeah, it's a surgical repair of the nose, often to fix a deviated septum. You don't have to know that specifically stuff, but rhino nose. All right, let's move along. Let's move along. Got a lot to cover today. Let's do it again. Hemopathology. So hemopathology, pathology. All right, we know this logy thing is the study of, right? The study of. But let's look at pathology, hemopathology. So we've got a prefix, hemo. We've got logy, the study of. So hemo, blood, hemophiliac, right? Condition where the blood doesn't clot. Logy, the study of. But we've got path in there. What's pathology? It's one of the topics on your MBLEx, right? Pathology. What is pathology? When you go to study pathology, what are you studying? You're studying disease or dysfunction, right? So pathology for massage therapists is like autoimmune disease, systemic disorders, diabetes, MS, Parkinson's, pregnancy is considered pathology. But pathology is the study of dysfunction or changes in the body. So, what do you think this word means? Hemopathology. Hmm. Hemo, blood, pathology, disease or dysfunction. Boom. The study of diseases of the blood. Hemopathology. I know, it's like we're back in school, right? Yes, it actually makes a little bit of sense, right? Okay. One more. Neuropathology. We just had hemopathology. Now we're neuropathology. What is neuro? Right? Yes. Good. So our prefix means the nerves or the brain. Pathology, the study of diseases. So what is neuropathology? Mm-hmm. Yes, the study of diseases of the brain. Boom. You're getting it. This is medical terminology. This is figuring out the words that you do recognize and putting them together to understand the full meaning of the word. All right, we soldier on. So you're getting the idea. Oh, we got one more. The biopsychosocial. This is a favorite of mine. Biopsychosocial. Yikes. All right, what words do you see in there? Bio, psycho, and social, right? We got a prefix of bio, we've got psycho, we've got social. The little frames are off a little bit there, but okay, so bio, psychosocial. We're looking at the biology, the psychology, and something social. And so a massage therapist approaches the body using the biopsychosocial method, meaning we look at the biology, we look at the body, the bio. So originating, where does pain originate? Is it in the biology? Do they have a sprained ankle? And is the pain also being affected by psychology? Is there a lot of stress? Is there a ton of stress that's affecting this person? And if so, if they're under a super stressful situation, they're moving, they're getting divorced, they have a loved one has passed away, All of those are psychology, they're mental. Is that affecting the person today? Look, as massage therapists, this is how we approach a body. We take into consideration their stress. And then what social pressures are on that client? Did they lose their job? Contributing again to mental stress. Have they moved to a new city and they feel alone? They recently lost a spouse and now they're alone. Socially, how have things changed for them? Is that impacting their condition right now? And I did write a book about this, about the biopsychosocial method. I know, it's so fun, right? Uh, and how pain may be telling a story. It's not just about the biology, you guys. It's not just about their body systems. It is about the stress in their life. And so as massage therapists, we get to address that. But for the purposes of medical terminology, you now know the phrase, the biopsychosocial method. And I'll give a little shout out, yay, to George Engel, Dr. George Engel, who back in the 1970s was really concerned that his colleagues, his medical professional colleagues, the other doctors he worked with, were relying so heavily on tests and screenings. So blood tests and x-rays and all of these external tests, looking at just the body, having a singular view, that he introduced his colleagues to this concept of the biopsychosocial method, meaning that treating a patient is more than just treating their body. Okay, if you're saying duh, I know. But this is a thing in traditional medicine right now, that they take a very singular approach. And where we as massage therapists come in is we get to address the stress. We get to address not only the bio, but the psycho and the social. Let's move along. Let's try one more. What is cellulitis? Ooh, it's actually easier than you think. All right, which part of this do you know? Let's look at the suffix. We talked earlier about arthritis. So that was joint inflammation. Itis is joint, right? So what do we got here? What's the first four letters? Cell, right? Cellulitis. It could be inflammation, inflammation of the cells. What? Inflammation of the cells? Yeah, this can happen. This is called cellulitis. It's very dangerous, actually. And it's caused by staph infection. It's caused by a bacteria, usually staph or strep, two types of bacteria. But it's a bacterial infection that affects the deeper layers of the skin. And it creates this redness. So if you see this on your table, this is actually a classic example of cellulitis, what it looks like. And why massage is avoided on cellulitis? Okay, we cannot massage cellulitis. It is a general contraindication. General. Did you hear me? General contraindication. Why? Because massage stimulates circulation and it can spread that infection. It's a bacterial infection. And massage can not only potentially spread the infection, but it can actually also interfere with that body's natural healing ability if we work above it, below it. So unfortunately, it's a very painful condition as well. So the likelihood of someone wanting a massage while they have active cellulitis is rare. But just in case, active cellulitis is a general contraindication for massage. Yeah. So I wanted to point out, because this is a general contraindication, I wanted to take a moment and just remind you of the difference between general and local, right? So we've got contraindications, meaning not indicated for massage. But we do have we have both local and systemic considerations. So infections can be localized, like an abscess, or it can be systemic, like the flu. It can be general. I mean, you're seeing a localized symptom, right? With that cellulitis, it's just in the leg. But even though cellulitis is a local, it's demonstrating itself locally, it's actually systemic. Even though the symptoms are just local, it is a systemic contraindication. So it's a systemic condition. So other things that you need to be aware of that are general contraindications, like blood clots, DVT, deep vein thrombosis, thrombophlebitis is a DVT, fever, and I wanted to throw in there, hey, thrombo, deep vein thrombosis. So thrombo is a clot. Phleb, if you know, so phleb is a vein. So a clot in a vein. Um, Thrombophlebitis. Yeah, that is itis, an inflammation, but there's thrombo, deep vein thrombosis is a clot in a vein. There are the resources that were used for these, for this, the foundation of this information. But let's carry on with more healthcare terminology. Yeehaw, here we go. We're gonna stay on, so we're gonna move through these words pretty quickly. Feel free to pause if you want to write them down. We're gonna send you the worksheets when this gets posted, but a lot of these you already know. All right, cardio, heart. Cardiology, study of the heart. Angio, that's blood vessel. Angiogram, an X-ray of the blood vessel. Artery, these are all cardiovascular terms. Arterial, you can see A-R-T-E-R, arterial. So arterial sclerosis, sclerosis, scleroderma. Sclero means hardening. So arteriosclerosis. Yeah, sclerosis. You'll hear that again. It's a hardening of the arteries. Phleb means vein, hemo means blood. Here are some terms around the respiratory system. Pulmonary. Pulmonary is related to the lungs, pulmono. Uh, bronchitis, inflammation of the bronchi. We talked about lungs and the respiratory systems in several of our lessons. The bronchus lead to the bronchioles, which lead to the areoles. Yeah, so the bronchus or the bronchi is one. Bronchitis is an inflammation of the lung. Heard of pneumonia, right? Inflammation of the lung tissue, pneumonia. Uh, Larynx, trachea. Again, these are words related to the respiratory system. Laryngitis, laryngitis. Have you heard of that one? Where somebody loses their voice? Laryngitis? Yeah, it's an inflammation of the larynx, inflammation of the voice box, usually. A tracheostomy. Now that's not ectomy, it's ostomy. So a tracheostomy is that little opening in the trachea, if you've ever seen that. Okay. Digestive system root words. Gastro, gastritis. Gastro has to do with the stomach. A gastroenterologist. So enter has to do with the intestines. So the stomach and the intestines are two separate parts of the digestive tract. Your food gets digested in the stomach, and once it's digested, it moves into the intestines. So gastroenterologist is a gastro doctor of the stomach and the large and small intestine. Hep means liver, hepatitis, inflammation of the liver. And these I don't even know how to pronounce. Whatever. Gallbladder, and then pancreas. Yep, pancreatitis, inflammation of the pancreas. Urinary system, and this is nephro does mean kidneys. So nephrology is the study of the kidneys. Reno also means is related to the kidneys. So uh, renal exams, renal failure. Hopefully you don't hear that word, but renal failure is related to the kidneys not working well. Yeah, maybe you've heard this with your pet. Sometimes when our pets get old, they start having renal failure. And that means their kidneys aren't working so well. Yeah. Cysto, a cystoptomy, has to do with the bladder, and then the urethra has to do with the urethra, not the ureter, the urethra. Nervous system, neuro, we talked about. Encephalitis, here we go again, inflammation of the brain. Meningi, so meningitis, inflammation of the meninges. That's the membrane covering the brain and the spinal cord. So meningitis is very dangerous. It's inflammation of that sheath that covers that membrane that covers the brain and spinal cord. And then I'm sorry, yeah. So it's a disease of the spinal cord. Again, some memorization here. Yeah. Musculoskeletal, osteobone, arthrojoint, myomuscle, and chondro is cartilage. Do know all four of those. Those will come up at some point in your MBLEx. Integumentary system, so our skin, hair, and nails. Dermo has to do with the skin. Cutane also has to do, like it sounds like cuticles. That also has to do with the skin. So dermatology, the study of, ology, the study of derma, the study of skin. Subcutaneous, subcutaneous. You may have heard of subcutaneous fat. It's under the skin. And reproductive system root words, or actually prefixes. Gyno, somebody may say, some female that says, oh, I've got a gyno appointment. Gynecology, the study of, ology, the study of women's reproductive system. Andro, androgenin, that is a male hormone. Okay, these are the ones I had to pronounce. I had to learn how to pronounce. Oophorectomy. I've never heard of this procedure. An oophorectomy is a removal of an ovary. And orchitis. Orchitis is inflammation of a testicle. Okay, reproductive. I'm really using these words to show you prefixes and suffixes. Hopefully you won't have these on your MBLEx. They're oophorectomy. But remember, ectomy, removal, itis, inflammation. So consistent, even though we're in a different system of the body. And these words have to do with our five senses. So what are our five senses? Sight, smell, taste, hearing, and touch. So ophthalmology is the study of the eyes, ophthalmology. Oto, we are ear. Rhino, the nose, and gloss is the tongue. Yeah, I didn't remember that. And just some other general medical root words and prefixes. Pathology, oncology, tumor. Typically, we see oncology and we think of cancer, but it's the study of tumors, oncology. Happens to be usually cancerous tumors. Cyto means cell, and histo means tissue. So histology, the study of tissue. Histamine. All right. So we'll walk through these root words one more time so you can get a sense of, we'll go through this list as a review. Derma, bang, skin, right? Gastro, where are we? I got a little picture here for you. Gastro, where are we? Boom, stomach. Rhino or nasal. Where are we? Boom, the nose. Opt, the eye. Yep. Pneumonia. Yes, this is going to be the air, so air or lungs. One of our favorites, myo. Myo means muscle. Okay, guys, cardio. Yep, heart. Artho, have I said it enough? Yes, joints, right? Yes, not just bones, joints. Because osteo, got osteo here for bones. Nephro, do you remember nephro? Nephrologist? Yeah, kidneys, good. Mammogram, breast tissue. Test or testosterone, yep, of the testes. Okay, here's another one, gluco or glyco. Gluco or glyco has to do with sugar. That's the glucose in the blood, the glycogen energy sources, and the neuro, of course, is nerves or brain. Nice. So quick, nice little review. These are words you are going to need to be familiar with, for sure. Some of these will come up on your test, for sure. All right, let's go through one more list. And I just want to get there. There we go. In fact, I'm not even going to go through this list because it's so familiar to you. Uh, if you want to see the examples of these prefixes, then you can walk through and look at, okay, macro or macro big, micro small, post is after, pre is before. These are words that I think you're pretty familiar with. And back to, again, some suffixes, ones you may not be as familiar with, but a dentist. So we've talked about a gastroenterologist. Ist usually means doctor, but you can see ism is a theory. Ectomy is removal. Plasty, surgical repair. You've got itis, inflammation, good. Ologist, a biologist, one who studies, cardiologist, one who studies the heart. Ology, the study of. Oma actually means tumor. Um, so oncology means the study of tumors, but oma means a type of tumor, like melanoma. So a tumor of the melanin-forming cells. Pathy, angiopathy, a disease related to blood vessels. Pathy is a disease. So pathology, disease, pathology or pathy, usually disease or dysfunction. Endoscopy, an examination within the bone. So the process of examination is to scope something. An endoscopy, you're going in the body, a visual examination within the body. And since earlier we were talking about cortisol, I did want to just make a brief mention about cortisol versus epinephrine and norepinephrine. They are all stress hormones. And yes, they're all evidence that stress has been there. Uh, and stress hormones that they all come from the adrenal gland, but there's different timelines. So just take a peek here. Epinephrine is like an EpiPen. So you may have heard of an EpiPen, uh, epi, up. Um, and so another name for epinephrine is adrenaline. And it's what hits like when there's first like that emergency button, it hits in seconds. Like emergency situation, boom, adrenaline kicks in. That's within seconds. And then right after adrenaline kicks in is the norepinephrine. That's, again, epinephrine, norepinephrine, boom. That's what comes in that very front end of an emergency situation or perceived stress. Cortisol, that comes in later. That's called like the long haul stress hormone. And so if you see this on your MBLEx, the long haul stress hormone, that is cortisol. It doesn't have to do with sharpness, alertness. This is more like, okay, we might have to run 25 miles to get to the nearest hospital. I got to sustain the blood sugar, I got to sustain the energy, and we've got to have long haul. That's why when cortisol shows up in the bloodstream, it's evidence of long-term stress because that is the hormone that is released when there is a longer-term stress scenario. So the real difference between those three is the timeline. Yeah. So just wanted to give you that piece of information. Okay, let's put ourselves to work. I'm going to do a case study. Ready? Case study being, here's a condition, okay? And we're going to assess some of the words here and make sure that we're going to treat our client safely. So your client's been diagnosed with uncontrolled diabetes, leading to diabetic neuropathy. They are experiencing dry, cracking feet. My question for you, you got your piece of paper handy? What system of the body are we talking about? What are the key terms in this question? And then, can you massage? Hmm, tricky, right? So, client's been diagnosed with uncontrolled diabetes. So, diabetes, what is the condition of diabetes? Let's start there. What system of the body are we talking about is being affected? So, diabetes, is that digestive? So, what's happening when someone has diabetes? Do you remember? Remember what's happening? They have uncontrolled blood sugar. So, their pancreas is not firing off enough insulin. Yeah. So, their pancreas is not firing off enough insulin, and their blood sugar is all over the place. That's uncontrolled diabetes. So the pancreas releasing insulin, what part of what system of the body are we talking about there? Hmm? Okay. Pick a system. It's one of 11. Pick a system. Next part of this question. Client's been diagnosed with uncontrolled diabetes, leading to diabetic neuropathy. Ruh-roh. Diabetic neuropathy? What the heck? So diabetic neuropathy is your term. And then they're experiencing dry cracking feet. So this is our question, right? Now we understand the question. Client has an uncontrolled situation. Not good. Uncontrolled situation, unpredictable, could be systemic contraindication. All right. We have those three components now. All right. Do you know which system of the body we're in? Let's take a peek. We're in the endocrine system because the pancreas secreting a hormone, insulin, secreting a hormone, insulin. So we're at hormones, endocrine. What are the terms? All right, the terms is diabetic neuropathy, or another word for that, peripheral neuropathy. Do you know people who have diabetes? Maybe it's under control, but their feet are a little numb. Happens a lot. Yeah. So their feet are a little numb. It's called peripheral. Remember peripheral nervous system? Peripheral, down those nerves on the feet. Peripheral neuropathy. So neuro, nerves, pathy, a dysfunction. And so this is a numbness in the feet or toes, and or lower leg. So can you massage? MBLEx question. Can you massage? Some are like, no way, I don't want to deal with this. Ah, wait, let's take a peek. Let's discuss. So your case study is uncontrolled diabetes. So dry cracking feet is experiencing complications due to diabetic neuropathy. High blood sugar levels damage the nerves, especially in the feet and legs, and this affects the peripheral nervous system, leading to peripheral neuropathy. Autonomic neuropathy could involve the neuropathy can also sometimes affect those autonomic nervous system functions like sweating or keeping the skin moist. So that's very often we see with diabetes and other conditions, these dry, cracked feet. Okay, so can you massage dry, cracking, diabetic feet? Hmm? I can kind of see your nose crinkle. Maybe you don't want to. Well, guess what? Yep, it's not always, when we see this condition, it's not always diabetes. It's just sometimes diabetes. Lots of other reasons this happens to feet, by the way. So, what are the other reasons? Um, and so the other reasons are being on, is if a person is on their feet for a long time, especially if they're on hard floors and bad shoes, unsupported footwear, like open back sandals, um, thong sandals, walking around barefoot can also lead to, sometimes, if you live in Florida or you live in the South or you live in like warm climates, you may see more dry, cracking feet from walking around barefoot. Obesity, just the extra weight. Taking long, hot showers will also will take away from the skin that natural moisture. And then a chronic condition, also such as diabetes. Okay, the big question. It's an easy one, yes or no. Can you massage dry, cracked heels? Answer is actually generally yes, you can. Again, MBLEx, we're going to be conservative on our MBLEx. We're going to look for a conservative answer. But if this condition shows up on your massage table, I want you to be informed. So, the benefits of massaging the feet is improved circulation, so they can actually get some of those that neuropathy. They can have more sense, they can have more sensation in their feet. They could relieve foot pain. And when we massage, we can moisturize that skin. Again, depends on the skin. I had just had this happen with a lovely lady, and I was like, "Oh, your poor feet. They're just all beat up." And it's winter where we are right now. That's another thing. Just being in shoes, being like it's just being dry all the time. So, again, fast forward, MBLEX, we're going to be so conservative. I want you to be aware of when you see these types of feats that it's only a rare chance that it's uncontrolled diabetes. So you can ask your client, has your client been in contact with his or her doctor or healthcare professional? So it is important, if this condition goes on for some time, that your client is in touch with a podiatrist. So see this word here, podiatrist, that's a foot doctor, or their general doctor. You, as a practitioner, will always avoid open wounds or infections. Um, you're not going to massage over open sores, ulcers, infections, as obviously it can worsen the condition, and of course, you could be exposed to an infection. Uh, with peripheral neuropathy, you also want to be aware of that reduced sensation. So you're going to be using more gentle techniques because your client's not going to be able to necessarily feel it as well as, or it could be hypersensitive. Just depends on how it affects your client. So, but use the appropriate moisturizers. And this is where you can add a tool in your toolbox. And you want to avoid those lotions that have fragrances, chemicals. You want to go with something super simple for these heels, and that's petroleum jelly or a diabetic friendly heel balm. Um, and don't put lotion between the toes. We're just treating the heel right now. And then, of course, make sure to wash your hands or have an antibacterial pump gel after you work on these. Again, just in case there's a little infection brewing there. So you don't want to use these harsh chemicals or fragrances on those feet. You want to use something simple. I usually have a little can of bag balm in my supplies. You want to use gentle strokes, very light tapping, depending again on your client. Um, and you want something that's a petroleum based or a urea based, as long as they're not allergic to it. But this is how you would treat heels that are dry and cracked. Yeah. So for the MBLEX, an abundance of caution, right? In real life, we want to assist within the capacity of our training. For the purposes of the MBLEX, usually only when the client has been treated they're in treatment with their healthcare provider if it is uncontrolled diabetes. If your client is just like from Key West and they're barefoot all the time, that's completely different. There's probably no neuropathy. But if it's uncontrolled diabetes, there could be some numbness of the feet. So that client would need to be under a doctor's care, or sometimes they go every 3 to 6 months. I know it's a long time in between appointments, but as long as they're in a dialogue with their doctor, you're covered. And please use gentle techniques with precautions. So, a little stroll down the pathology trail there. You ready to dissect some questions? All right, let's shake it off, shall we? Let's shake this off. Shake off all that learning. Let's do a little twist. Can you twist? Can you rotate your spine? So I'm going to show you rotation of the spine. Boom. So my sit bones are planted, but I'm rotating my upper body. This feels nice if you've been sitting for a while. You can also do it like I Dream of Jeannie, or just with your arms crossed in front of you. Or you could even do it with your hands touching opposite shoulders. This just warms up the spine. All right. And then one more. Let's roll those shoulders back. So go ahead and roll those shoulders back, bringing those shoulder blades down. Good. Look, guys, we're almost an hour and a half into studying. Being sedentary for an hour and a half, your body starts to be like, ooh, I want to wiggle. So we got to give it a little wiggle. Good. Roll those shoulders up, down, up, back, and down. Pinch those shoulder blades together. If that is a little bit difficult for you, imagine bringing your elbows back and together. They're probably not going to reach. But if you bring those elbows back and pushing them together, that's pushing your shoulder blades together. That helps to soften that part of your spine. All right, gonna warn you ahead of time. Be careful to find the best answer. Here we go with some medical terminology. But again, I'm gonna be kind here in the beginning. Get a little warm up for you. Remember our questions from the beginning of our session? Here we go again. Remember our warm-up quiz? Okay. Which word is associated with a part of the integumentary system? A, sclero, B, phleb, C, dermis, D, neuro. Do you now know what each of these stand for? Yes, you can put it in the chat. Just go ahead and we're not even going to do 3, 2, 1. We're just going to do chat. We're just going to go for it. Good. Yes. Yes, iPhone. Yes, Carol, Chanique, Shireen, Rob, Camelta. Good. Good, good, good. Yes. Best answer. Not neuro, that's nerves, right? Boom. Dermis. Good. Next question. What hormone is responsible for helping the body deal with long-term stress? A, cortisol, B, epinephrine, C, insulin, D, melatonin. Hit it. Mm-hmm. Mm-hmm. Johnny, you got it. Rob, Shireen. Yep, yep, yep. Good. Best answer. Long-term stress is not insulin. Boom. Cortisol. Yep. Cortisol. Number 3. Lymph nodes are important because they what? A, produce insulin. B, filter lymph and fight infection. C, create melanin. D, regulate body temperature. Go for it. You can go ahead and put your answer in the chat. Shireen, you're in. iPhone, you got that one. Chanique, yep. Rob, Carol, good, good, good. Best answer. Lymph nodes aren't regulating body temperature. They're filtering lymph and fighting infection. Good. The adrenal glands are located where? A, on top of the kidneys. B, oh good, Maria, thank you for chiming in. The adrenal glands are located A on top of the kidneys, B inside the brain, C beneath the liver, D along the spinal cord. Where are the adrenal glands located? Mm-hmm. Mm-hmm. Camelta, yep. Rob, good. Shireen, Shanique, iPhone, yep. You got it. They're not on the spinal cord. Ooh, Maria, are you in? There you go. Boom. Good. On top of the kidneys. Yes. So here are our kidneys. Our urethra. And right on top, that yellow, the adrenal glands. Oh, these are the ureters. Sorry, the ureters. Good. The prefix hypo in hypothyroidism means what? Okay. A, over or above. B, fast. C, under or below. D, beside. Go ahead and put your answers in the chat. And we got Camelta, yes. Rob and Shanique, good. Shireen nailed it. Careful. Hypo. Best answer. It's not beside. Got one more. iPhone, you nailed it. Good. Bang. Under or below. Yes. So, little bit easier with those 5 questions, huh? Familiar? A little easier? All right, let's get into some new questions. Blank is key to understanding long words in medical terminology. What is key to understanding long words in medical terminology? A, beginning, middle, and end of the word. B, sounding it out. C, pronouncing the word correctly to other healthcare professionals. D, identifying prefix, root, and suffix. You can go ahead and put your answer in the chat. Shanique and Camelta, iPhone and Shireen, Carol and Rob. Yes. Doesn't matter if you can sound it out. Identifying the prefix, the root, and the suffix. Maria, nice. Good. Good, good, good. Next question. This is about word parts. Okay, you've probably never heard this word before. That's okay. Here we go. What is the best definition of cardiovalvulitis? Cardiovalvulitis. A, inflammation of the heart. B, inflammation of the vulva. C, inflammation of the heart valves. D, irregular heart rhythms. See what we've got. Chanique and iPhone and Shireen and Maria, Carol, and Rob. Excellent. Excellent. You figured out that word. Had you ever even heard of that word before? Have you ever even heard of this condition? It's not inflammation of the vulva. It's inflammation of the heart valves, right? Cardio, valve, itis. Cardiovalvulitis. You figured it out. Nice work. And away we go. Your client tells you that they have the condition thrombophlebitis. What does that tell you? A, it's a common bacterial skin infection that affects the deeper layers of the skin and underlying tissue. It is caused by bacteria, typically staph, and entering the skin through a break or a wound. B, thrombophlebitis means they've had recent surgery to correct a disc problem in their thoracic region. There's normal inflammation after surgery, and you'll avoid that area. C, thrombophlebitis means they have vein inflammation that happens in connection with one or more blood clots. This usually happens in your legs, but it can affect any vein. Or D, thrombophlebitis is recent surgery to remove varicose veins that has now developed into some inflammation. Thrombophlebitis. Shanique, you're in. Shireen. Rob. Camilta, yes. Excellent. It is not a disc problem in the thoracic region. Even though thrombo looks like thoracic, that is not what we're talking about. Best answer. Thrombo clot, phleb vein itis, vein inflammation that has to do with blood clots. It usually happens to your legs, but can affect any vein. Good. Thrombo, clot, phleb vein itis, inflammation. On the intake sheet, your client indicates that they had an appendectomy. They have fully recovered over the last 8 weeks. What procedure did they have? A. Surgery on the appendix. B. Surgery on the appendicular skeleton, normally a broken bone in the leg. C. Removal of a skin appendage. D. Removal of the appendix. Let's take a look at your answers. All right, I'm gonna go to Bob. Carol, yeah. Rob, yes. Shireen. Chanique. Camelta, yes, yes, yes. Good. Maria, you got it. Nice. Oh, did I miss one? Hold on, hold on. All right, good, good, good. iPhone, you're in. Best answer is not removal of a skin appendage. The best answer is removal of the appendix. No one picked A, which was surgery on the appendix. And by the way, as of 2026, there is no repair of the appendix. They don't repair the appendix. They take it out. Still not sure what it's there for. Yeah. Yeah, right? Almost. I know. It's why those MBLEx is tricky. They'd be like, did they have surgery? But remember, ectomy is removal. Ectomy is removal. Okay. The prefix hypo means what? Do you see that hypo? Means what? Does it mean A, homeostasis, B, sugar, C, high or fast, D, low or slow? The term hypo means good, Camelta, good. Shireen and iPhone, good. Carol and Maria nailed it. Shanique and Rob, Hypo means not homeostasis. Hypo means low and slow. Yeah, low and slow. That's right. Good. Next question. What is the condition hyperglycemia? Can you pull out the word elements of that word? What do you see in there? A person who eats too many desserts. B, too much glucose in the system. C, too little glucose in the system. D, both high and low blood glucose. What is the condition? Hyperglycemia. Camelta and Shanique, Shireen and Rob, yes, iPhone, you got it. Yay, 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 yay. What else we got? Maria, yup, good. Best answer is not. It could be the person eating too many desserts, but the best answer is too much glucose. Hyperglycemia, too much glucose, too much glycogen. Glycogen or glucose is blood sugar. All right, here we go, here we go. What kind of doctor is a nephrologist? What type of doctor is a nephrologist? A, nose, B, kidney, C, heart. And our best answer is coming. I don't know. Oh, okay. Maria and Carol, good. iPhone and Shireen, yes. Rob, nailed it. Camelta, good. Chanique, yep. Good, good, good. Best answer is not a heart, because that'd be a cardiologist, right? Yeah. So best answer, B, the kidney doctor. Nephrologist. That was a tough one. Good. Okay, here we go. Your client is on the table. When you notice they have dry, cracked feet, what is the best course of action? A. This condition is evidence of uncontrolled diabetes. Ask the client when is their last time they saw the doctor. Proceed with caution. B. Avoid the area. There's a chance of infection, and you don't want to make it worse. C. Check their chart for an indication of diabetes. Assess pressure for peripheral neuropathy. Treat the area with gentle massage using a petroleum jelly-based product. D. Ask the client if they have diabetes. Let them know you can't work on that area because it's probably painful and massage won't really help this condition. All right. Client is on the table and you notice they've got dry, cracked feet. What do? Mm-hmm. Camelta, Maria, iPhone, Rob, Shireen, Shanique, yes. Look at you guys. Yes. So don't avoid the area. Avoiding and not talking about things, that's not how you're trained. You're not going to just ignore it. You are going to, boom, letter C. You're going to check their chart to see if you missed that maybe they've got diabetes, but they didn't tell you on their chart they did. So you're going to assess pressure for peripheral neuropathy. And either way, you're going to treat that area with gentle massage using a no harsh chemicals, no fragrances, but petroleum jelly-based product. Good for you. All right, hang in there with me. Your client indicates they have had an arthroplasty. What have they done? What have they had done? Excuse me, what have they had done? Arthroplasty. Let's do it, guys. Let's break it down. Can you see it? What can you break out of there? What do you see? What do you see? What do you see? We've talked about this prefix a couple of times today. Okay. A, repair to a bone. B, repair to a joint. C, repair to an artery. D, repair to their nose. Uh-huh. Let's see what we got. Woo! iPhone is in. Chanique. Shireen, yes. Carol, good. All right. Take a peek. It is not a repair to their nose. That's a rhinoplasty. Plasty is repair. What did they have repaired? They had an artho repaired. So they repaired a B. They had a repair to their joint, an arthro. So like arthritis, right? Be very careful there. Arthroplasty. We actually did see that word earlier, and it was a joint repair, a surgical repair to the joint. Next question. What would be the best definition of a gastroenterologist? A, a client experiencing digestive problems, such as irritable bowel syndrome or Crohn's. B, a doctor who specializes in treating the brain. C, the condition of heartburn, acid reflux, and celiac disease. D, a doctor who specializes in treating digestive issues. Okay, let's go to the chat. What would be the best definition of a gastroenterologist? Jonique, Rob, Carol, Shireen, iPhone, John Robert, Maria? Yes, a gastroenterologist is not the condition of heartburn. It is the doctor who specializes, gastrostomach, ologist, the doctor, the person. Very good, you guys all got it. Yay! Nice work on that one. Good. Maybe you've heard of that guy before, the gastroenterologist? Yeah, good work. All right, that's a wrap. Woo! Holy macaroni. That was a lot. So let's get back to our gallery. Yeah, good work today. How's the body feeling? How's the brain feeling? Ooh, yeah. Yeah, I agree, Shireen. You guys did good. This is a bumpy ride. Yeah, this is a bumpy one. Medical terminology. It can be a lot. Yeah, so I hope you're feeling great. I see great. Yes, good. Because we're about an hour 40 minutes, hour 30 to an hour 40 minutes into our studying. This is an indication of your test-taking stamina. The magic number is 100 minutes. So an hour and 40 to an hour and 50 minutes for you to stay steady, stay focused, stay present. That indicates your test-taking stamina is there for the ability to focus. Now, we just polish the diamond. We just add knowledge to that big, beautiful brain and have that come forth during your focused practice exam sessions and your focused time when you take your MBLEx. I'll wrap up this recording by saying my name is Jody Scholes. I'm an instructor. I am your instructor for the MBLEx review course. We'll be meeting next week with Members' Choice. Members' Choice next week. Very exciting. And the winner of our Members' Choice, because you guys voted, you took a poll, and it was test-taking strategy and pathology. So next week we are going to be dissecting questions using our test-taking strategy, and the questions are all going to be on pathology. So Miss Tara has an announcement posted for that. I'm going to hang out with this gang for a little while, answer a few questions, but have a great day. Have a great weekend. We'll see you again next week. See you again real soon.